Home visiting may be required for patients who are very elderly, infirm or essentially bedbound, or for whom travel might cause a deterioration in their condition. Visits are carried out overnight from 6:30 p.m. to 8 a.m. Monday to Thursday and are 24 hours over the weekend and at bank holidays. The visiting clinicians are GPs or emergency nurse practitioners or emergency care practitioners with the assistance of an emergency nurse assistant or a driver. Good preparation is essential for the smooth running of the visits, as once you're out visiting it may be difficult and time-wasting to return for further supplies. Prepare for your visit. Check the drug bags. Check the grab bag. Check the patient's information details. You may need to gather any extra equipment before you leave the building, such as controlled drugs or a syringe driver. You will have 2 drug boxes to take with you out visiting. The first one that I'm looking at contains TTOs. All the drug boxes have the same drugs in them across counties, so whether you're working in Oxford, Banbury, Witney, Abingdon or Henley, there will be the same drugs in them. You need to check these drugs against the list that's within the box. The drugs will be such things as antibiotics for paediatric and adult dose, antiemetics. There will also be inhalers. The second box contains stat doses of medication for administration, tablets and injections, things like antiemetics, metoclopramide and cyclizine. Here is an anaphylaxis box that is kept in here. There are also other tablets like prednisolone, furosemide and Voltarol, and GTN spray. There's some cyclizine. There is also a supply of syringes and needles and some Benflons. Also, this is where we keep the nebules for nebulizer. We carry salbutamol 2.5 and 5 milligrams and some Atrovent. This can be run through the nebulizer, which is in the car, or driven through oxygen. There's also glucagon and here Voltarol for injection. Once you've checked the drug boxes, seal them with tape and date it. Then you know you've checked it and it's sealed and you know what's it. Now the boxes are ready for visiting. This is a grab bag. There's a sharps box always in each grab bag, and there's loads of equipment. There's pregnancy testing kits. We don't use them very often, but we always carry them. There's tongue depressors and pots for urinalysis. There will be a sphygmomanometer, stethoscope. There's a thermometer. Check your thermometer's working properly. Sometimes when they're kept in the car they get really cold. You have to just hold it in your hand and warm it up a bit to get it to work. This happens a lot over the winter weather. You need to check all your equipment, make sure the batteries are working. So there's an otoscope, an ophthalmoscope, and also a SATS probe, which you can just check the battery, put it on your finger, make sure it's all working well. There are peak flow meters with mouthpieces, there's a face mask, and there's urinalysis sticks. There's also a list which you can see propped up against the wall with a list of everything that should be in that bag. So until you're familiar with the bag, make sure you do check it, because you don't want to get out on a visit and not have the right equipment. All ready to go. Before you go out on your visit, you'll need to check the details. How urgent is it? You may need to prioritise your visits. You may want to discuss the visit further with a GP. You might need to check out drugs from the CD cupboard before you go. When you go out on the visit, you'll be going out in a four-wheel drive car. It'll have a sat-nav to help you locate the property. There'll be a phone that you must use for any correspondence to hospitals or back to base. There'll also be a rugged laptop that will be kept in the car for you to complete your notes. Occasionally you can't get a good reception, so always make sure you write everything down because you might need to do your notes when you get back. In the back of the car there's further equipment that you need to check over. This is a catheter box for catheterizing patients or irrigating catheters. There's also a nebulizer and there's a dressing box here. We don't do many dressings. The dressing's usually done by a district nurse, but sometimes we are called out in an emergency. We do carry equipment for resuscitation. This box contains ambu-bags and airways. We do not carry defibrillators. We carry one portable cylinder of oxygen. Check that it is full and that you've got the necessary face mask and lines. Gaining access to the property is usually straightforward, but sometimes you'll need to telephone ahead asking for specific directions, particularly so in rural Oxfordshire where some homes are difficult to find. Some patients will also have a keypad and you'll need to locate this and know the number so that you can get the key to enter the property. You'll need a torch to do this at night. Sometimes a neighbour holds the key or a relative. When visiting, please be aware of your personal safety at all times. While some out-of-hours home visits may be to patients you know, mostly it will be to patients that you don't know, so be extra vigilant. There is a personal alarm fitted within the grab bag which will make a very loud noise when activated. Do not enter a building unless you've been invited to do so, and if you are concerned about the visit, make sure you enter the building with your colleague. Don't go in alone. Always ask for dogs to be put into another room. Dogs can become very defensive if you're treating their unwell owner. On arrival, introduce yourself. Clarify at the door who you are and who you've come to visit. Show your name badge and ID. Always be courteous and professional. This is the patient's home, and only enter if you're invited to do so. Before you examine the patient, you will need to wash your hands. Sometimes this is possible within the house, but it will greatly depend on the facilities. Sometimes you'll be offered a clean basin and towel to use, and sometimes not. If you don't think the facilities are sufficient, there is always hand gel in the grab bag and in the car. The consultation will take place where the patient is most comfortable. This may be in the bedroom or in the living room. Your consultation should be as thorough on a home visit as it would be on a base visit. Ensure you take a good history, perform a thorough examination and record your findings. Be careful of your back. Working in a home will be very different to working in a clinic setting. The rooms may be small, you may crouch, there won't be the right bed height that you're used to. There may be poor lighting. If you need to give your patient any prescription medication, ensure that you explain it thoroughly to them. Leave written information about your diagnosis, treatment, follow-up and any red flag areas for concern. Safety net your patient. The car is your office. Make any phone calls from the car with your work BlackBerry. This includes any referrals to hospital, any admissions, ambulance bookings, or simply if you need advice from a GP. There is also a folder of out-of-hours service guidelines and a PGD folder for staff who are not prescribers. Lastly, don't forget to use the hand gel. Back at base, ensure you dispose of any clinical waste appropriately and replace any used drugs. Your notes need to be contemporaneous. If you've been unable to complete them whilst on your visit using the rugged laptop, you need to do them now. And remember to shred any old paper notes. And finally, remember to look after yourself. Don't forget to eat and drink and take that all-important comfort break while you can.